Alright guys, I'm Dr. Bogart. Today we're going to be demonstrating a shockwave laser therapy session to someone who has plantar fasciitis. So right here we have our patient on the table here. I've got Jody, my assistant. First we're going to start by putting the ultrasound gel, which is a conductive medium, which allows us to do the shockwave. Shockwave is an acoustic sound wave that goes in and it breaks up scar tissue, trigger points, pain patterns, adhesions, things of that nature. So we're going to put the lotion or the ultrasound gel on the body parts we're going to be using, and then we're going to go ahead and get started with the shockwave therapy. Okay, so that tapping sound you hear is the machine. There's a device there. It's oscillating back and forth, creating sound waves into the tissue. And right now we're doing what we consider the discovery phase, where we're looking for a point, and we're asking the patient to tell us when you feel a point that feels a little tender or painful. And if you do, we're going to stay on that in an effort to break that pain pattern, trigger point, adhesion up. Any spots bothering you yet?
Right there.
Right there? Okay, so we're going to leave it there for approximately 15 to 1800 acoustic shocks to break that up. And we want the pain to be, or the discomfort to be, between a 5 and a 6 out of 10. Does it feel about that high?
Yes.
Good, okay, we're going to keep it right there. All right, so there's another spot we found in the calf. Now, sometimes when we do plantar fasciitis, we do find spots in the calf or the achilles, so that's why we do a complete lower leg treatment, not just the actual spot of the plantar fascia. Right, so now we're going to get into the foot, and we're going to start working through the tissue of the plantar fascial surface. See if we find a spot. Sierra, let us know when you find a spot. Right there? Okay, so we're going to leave it on that spot and break up that. Alright, so now that that point's taken care of, we're going to move down towards the foot. An entire treatment usually takes between 8 to 10 minutes to do. And what we do is we combine the shockwave therapy with class 4 laser. So when we combine the class 4 laser after the shockwave, essentially what we're doing is we're breaking up those damaged tissues, tight tissues, inflamed tendinopathies, tendonitis, and then we use the class 4 laser after to stimulate that tissue to heal fast. Okay, so now that we're done with the shockwave and we've cleaned up all that ultrasound motion, we're now using the class 4 laser to stimulate that tissue that we just worked on to heal even faster. So the combination of the two, between the shockwave and the class 4 laser, we get great results getting people feeling really good. Usually within about 5 to 6 sessions is the max that we usually need to do. Although plantar fasciitis can be a little stubborn, sometimes we need an additional session or a few. And we do what we need to do in order to get that patient back on the road and feeling really good.
Does it feel warm? Yes.
Good, yeah. We're also going to get some of that calf area that we found some spots in and getting those areas to heal as well. And this usually takes another 8 minutes or so to really get the tissue stimulated with the class 4 laser, which does what's called photobiomodulation, and that stimulates the tissue to heal. All right, so that's what the shockwave and class 4 laser look like, or at least one session looks like. Of course, it's going to be longer than the video, to help people feel better, function better, and get them back to what they want to do in life, whether it's plantar fasciitis, rotator cuff issues, knee issues, hamstring tears, you name it. The techniques that we have and the methods we have make a huge difference in people's lives. I'm Dr. Joseph Bogart. Thanks for tuning in. We'll see you on the next video. Bye-bye.